Hello, I am Dr. Robert Kessler. I'm a board-certified plastic surgeon practicing in Corona del Mar, and I have decided to put these videos together to answer some of the most commonly asked questions of me in my practice. One of the ones that has recently become interesting to me is the question of plastic surgery and mental health. What's fascinating about that is early on in my career, I recognized the power of plastic surgery in terms of improving someone's overall mental health, in terms of their self-confidence and their sense of well-being, really. But during this period of COVID, it's been really fascinating to me. We are all walking around with masks on, and so all anyone is able to see is just your eyes. And yet everyone still keeps coming in for fillers. And you would think, oh, if my face is covered all the time, why would I bother coming in for fillers? And it gets to this point exactly. We have an image of ourselves we believe in, we see, and we are accustomed to seeing it. And as we age, that image changes. And we're not really comfortable with the idea of that changing. And to be able to restore that more youthful appearance to your face really has a very powerful impact, even though it seems like a minor thing. The way I talk to my patients about this is, something that's just a personal experience. Your alarm goes off in the morning, and the first thing you do is you run your internal check, and you're like, okay, I think I feel pretty good. I think I feel pretty well rested, and you think, it's going to be a great day. And you walk into the bathroom, you turn on the light, and all of a sudden, you don't even aware of it, and you're like, wow, did I get a good night's sleep? Do I feel well? Am I tired? Your eyes are puffy, your skin under the eyes is a little lax. And what just happened in that millisecond, right? You went from feeling fantastic, thinking it's going to be a great day, but all of a sudden your physical appearance has impacted you, right? And so that is a minor thing, but it's something that I really think resonates with that whole idea. The other thing I think is really interesting is how we perceive vanity as a negative emotion, but we think of self-confidence as such a positive one. They're really not that different in my mind. One obviously is an excess, but it all comes back down to the same basic idea. How do you feel about yourself? And if you are noticing things that are upsetting to you and they're bothering you on a regular basis, it's very reasonable to explore the idea of correcting them and, seeking out someone who's educated in the field, who will give you good advice, someone you can trust, and someone that will help you with your goals. I find, this whole idea of self-confidence also a very interesting thing, and I base it on stories, my own patients that I've had. And many years ago, I had a patient of mine, a woman that moved to Orange County from another state, and she moved into a neighborhood near the office. And she really felt like she was having a great deal of difficulty making friends. She didn't think that the women in her community were welcoming, that she was having trouble kind of integrating into the community. And she ended up in my office, interestingly enough, because she thought that she was interested in having a breast augmentation. And so we had talked about it. She was a great candidate for it. She was interested in doing things for the right reasons. And so we went ahead and did her breast augmentation. And she did beautifully. And I see my patients at 1 month, 3 month, 6 month intervals. And at the 6 month meeting, she came back and she was incredibly happy, and we were just having conversations. And, she had found a new group of friends. She was doing things socially. She found herself really integrating into the community, just beautifully at this point. And she really attributed it to the fact that she was actually insecure about her appearance. And when she felt confident with herself, she was able to go out into the community and engage on a level that was now great for her, and it made a real difference. And I'm not saying that the breast implants improved her social situation. It basically gave her the self-confidence that she needed to engage these people that she had previously avoided. About 6 months ago, I was reviewing some of the literature that was coming across my desk, and it was interesting. It was an early study, not scientifically significant, that basically said that Botox helped with depression. And so I was like, oh great, here we go. And but I said, okay, let me look into this just a little bit. And as I mentioned, not a scientific study. They compared a group of women that did not get Botox to a group of women that did get Botox, and these women each rated their own happiness score. And what they found was, it was statistically significant in their study that women that got Botox rated themselves as happier. So, again, didn't put a lot of credibility in the study itself. But what was really interesting was the author of the study came up with his conclusion for this, and this is where I found it interesting. Basically, what he was saying is, as social animals, we are programmed to read each other's faces to understand emotional states. Obviously, when there's danger, when there's anger, when there's happiness, when there's sadness. And what this individual concluded was, what was happening in the women that got Botox is, not only do they read, or we read, our other people's faces, we read our own faces. And so by going ahead and placing Botox and removing signs of anger and stress, we weren't getting that feedback that we were typically getting before. And so the idea behind that was, by reading our own faces and seeing less anxiety and less stress upon our faces, made us happier. I hope this was helpful. If you liked what you heard, please post your comments below. And if you have questions that you would like answered, please message me on my Instagram.